Hello, I'm Dr. Nadia Khan. I'm an Associate Professor of Medicine at the University of British Columbia and also a scientist at the Center for Health Evaluation and Outcome Sciences.
Hi, Dr. Khan. Thanks for being with us here today.
No problem.
In your research, what were your findings about the barriers that place South Asian and Chinese populations at greater risk of heart disease than Caucasians?
Well, what we found was that South Asian and Chinese patients had really similar types of things that caused heart disease as everybody else. But the differences were that Chinese and South Asian patients were a lot less likely to exercise, which is one of the major risk factors for developing heart disease. And we also found that South Asians in particular had a much higher rate of developing high blood pressure and diabetes. And these are again two major drivers of heart disease.
Okay. What advice do you have for practitioners that would help them understand how cultural diversities can stand in the way of delivering optimal heart health care?
Well, one thing that we found was that South Asian and Chinese patients were a lot less likely to take their heart medications even after they've been diagnosed with heart disease, which is a really substantial problem. So health practitioners would need to speak with their patients, check to see whether or not they are taking their medications, and try to help them with maybe some of the barriers that might be contributing to the fact that they tend to stop taking their life-saving treatments within even a year after heart attacks.
Okay. Can you talk about how the program for improving and preventing cardiovascular disease in South Asian and Chinese populations will improve heart care?
Well, we've established a large research program trying to tackle some of these major issues that we're finding. And we're really looking at a couple of key areas. One key area is trying to encourage health promotion, so making a healthier lifestyle to prevent some of these problems like diabetes and hypertension. And we're conducting a series of studies targeting those kinds of issues in the South Asian and Chinese populations. We're also looking at it across the country. We've got a very large study that we're doing looking at how Chinese, South Asian, and general populations manage their heart disease, and looking at specifically what are the cultural barriers to doing so. And from that data which we're collecting, we are going to pursue other studies that are actually targeted against these barriers to try to improve heart disease management in these populations.
All right. Thank you so much, Dr. Khan.
Thank you.